Hello everybody, I am Dr. Udaykumar and today welcome to my channel Life Care Clinic. Life Care Clinic is a specialty clinic which deals with the infectious diseases in the human beings. I am specialized for HIV and hence I am doing my practice from past 15 years. My website is hivclinic.co.in and my mobile number is mentioned below. As you know, we have to take standard precautions and which help us to get away from the infections. We can avoid the risk of infections as infections are present all over the surfaces. As we know, this is a modern time when we are facing corona and other infectious diseases agents which are out there. But we have to work up as a medical worker so that we can protect ourselves as well as treat the diseased people. We have to undergo special precautions in which we have to work up in fewer systems. Number one is called as hand hygiene. As we know, hand hygiene is the prime important workup which help us to get away from 99.9% of the infection. And secondly, use of personal protective equipment or PPE kits which help us to protect ourselves from all types of aerosol infections as well as liquid water infections as well as solid waste. We have in PPE gloves, gowns, masks, eye protection and face protection kits. We have to work up in them so that we can protect ourselves and at the same time treat the needy. So, why and what are the various ways by which we can treat them and what are the standard precautions? Previously, this was known as universal precautions or universal safety precautions. But now we are taking it as standard precautions which are designed to reduce the risk of the transmission of bloodborne and other pathogens from both recognized and unrecognized sources to a susceptible host. So, what does they include? They include the basic level of infection control, precautions, and secondly, the hospital infection in the result of the combination of factors. Number one, the source, the microbial source. Second, the transmission and the susceptible host, which in turn leads to the infection. So, the standard precautions play a key role in avoiding the risk or reducing the risk of transmission of the pathogens. Let us see the history of infection control precautions. If you see, when did it start? It started in the early 18th century, 1877 and 1910, when there were separate facilities for antisepsis and disinfection. So, in this way, the use of clean hands or cleaning the surfaces helped us to decrease the infection and later for better recovery. In the 1985, when there was advent of HIV, we found out universal precautions which had guidelines for protecting both the healthcare worker because the emergence of HIV and other bloodborne pathogens. In 1987, it was founded the body substance isolation, that is, there were areas in which there were focuses on protecting patients, health persons from all the moist blood fluids, body fluids, not just blood, semen, vaginal secretions, wound drainage, sputum, saliva, etc., which in turn were found to be pathogenic. Later, in 1996, the standard precautions, there are two levels. Number one, the standard precautions which apply to all clients and patients attending the healthcare facilities, and also the transmission based precautions which apply only to the hospitalized patients. In 2007, there were isolation precautions when we found out new pathogens, the aerial pathogens, the SARS, the avian influenza, H5N1, H1N1, and now currently we are facing the corona. As we know, the isolation precautions had various systems of steps. Number one, the standard precaution, in which we have the universal precaution, in which we use gloves when we are dealing with any kind of blood or blood related particles, and body substance isolation, in which any body substance from the part we should be isolated. Secondly, there were transmission based precautions. So as we know, there are 2 or 3 types of them. Number one, the airborne precautions. The airborne precautions which are present, as we know, while coughing or sneezing, and droplet precautions which also come under coughing part. And thirdly, the contact precautions, as the close contact they can lead to infection. In corona, we have found and dealt with all kind of infection precaution control which help us to curb the infection. So what are the key elements of standard precautions? Number one, as usual, it is hand hygiene. As you know, hand is the part which takes part in each and every part of the infection. So if you can control the hand movements and hand hygiene, definitely we can work up. So what are the elements that help us to do the control the precaution? Number one are the gloves. So if you use proper gloves, if we have double coated gloves, we are minimizing the infection. Also mask, goggle, face mask, which we sum up in a PPE, they also help a lot to decrease the infection. Also use of gown. Why are gown useful? Whenever there is an infection that will fall on the gown and when we discard it, definitely that infection won't reach in our body. Also prevention of needle stick and injuries from sharp instruments also prevent a lot of infections like HIV, HBsAg, HCV, and all other infections like malaria and etc. Also respiratory hygiene and cough etiquette. These are things which are little bit worked up in the newer generation, as the population of the world is increasing and the travel is also increasing day by day. We need to take into consideration the respiratory hygiene and also the cough etiquette. The third generation or countries have low cough etiquettes and respiratory hygiene, which in turn can lead to the infection of people and then transmit the infection to the large number of people. As it is the international travel era, we have seen people going to the affected areas, getting infection from there, and then transmitting it to higher density population areas of Asia and causing a pandemic. Then there also are environmental killing issues. A lot of areas are not properly clean, or due to temperature conditions, it is unusual to help to decrease the infection. The linens, the waste disposal area, and also the patient care equipment also come under the standard precaution key elements, which should be worked up properly so that they can get the best of the results. Now, what are the definition of hand hygienes? Hand hygiene or hand washing starts with plain soap and water. So plain soap and water will clean out the dirt as well as any kind of infective material on the body. After that, we have to use the antiseptic hand wash. What is antiseptic hand wash? Antiseptic hand wash is washing hands with water, soap or other detergent containing an antiseptic agent, which will decrease the infection to 99% from the hands. Then we have to use an alcohol based hand rub. Rubbing hands with an alcohol containing preparation will decrease the microorganism as well as evaporate the surface agent so that we have clean hands. Lastly, you have surgical hand hygiene antisepsis, in which hand washing or using an alcohol based hand rub before operation by surgical personnel will definitely decrease the risk of infection and increase the hygiene issue. So there are 5 moments for hand hygiene. Number 1, before touching the patient, we should have clean hands. Second, before cleaning or aseptic procedure is done. Then thirdly, after body fluid exposure risk is there. So if you are changing a catheter or urinary tubes, definitely we should work on that. Fourth is after touching a patient. So before touching is number 1, after touching is after 4, and then after touching the patient's surrounding also we should have hand hygiene so that we don't transmit the infection to the next patient. So as we see, hand hygiene technique with alcohol based formulation is for only 30 seconds. So within 30 seconds we apply the product to the cupped hand, covering all the surfaces. Then we rub the hands palm to palm. After that, we right palm over left dorsum with interlaced fingers and vice versa, so that the dorsum is also clean. Then to palm with fingers interlaced. Then backs of fingers to opposing palms with fingers interlocked. Then rotational rubbing of the left thumb clasped in the right palm and vice versa, so that the thumb is clean, and rotational rubbing of the backwards and forward with the clasped fingers on right hand in left palm and vice versa, so that the tip of the fingers are also clean. And once you dry your hands, you are safe. So these are all the things we should consider, and not only the palm. So it is palm, the dorsum, the finger, the thumb, and then we have to dry it. So if you see, the duration of the entire process is for 40-60 minutes. We are using soap and water because we have to first wet the hands with water, apply enough soap to cover all the surfaces, rub hands palms to glove, palm to palm, then right palm, left thumb and left dorsum, and vice versa. Then palms to palm with fingers interlocked, backs of the fingers to opposing palm, then rotational rubbing of the left thumb and clasp in the right palm and vice versa, so that you get your hands dry. So as we see, the potential harmful microorganism, if you see in a slide, then therefore there are a lot of organisms we can see in the growth in the petri dish, but in the right, after washing the hands, the germs are cleaned, and therefore less and least number of germs can be seen. So I believe that the most important thing we can do to stop the spread of germs is to wash your hands. So wash properly, wash thoroughly, and we can get the best of the result. Now the PPE. Sorry. The PPE, as we know, gloves, gowns, mask, goggles or face shield, they should be used when we touching body or blood or body fluids, secretions, excretions or contaminated items, and for touching mucous membranes and to non-intact skin. Even gowns should be used for any procedures where the patient care activity is done if you are in contact with the skin or blood or secretions or excretions. And mask or goggles or face shield should be used during patient activities that like to generate splashes, sprays of blood, body fluids, secretions, excretion, and even aerial suction of the air of the infection. Now, if we are having suspecting influenza or corona as we had, we have to have full barrier protection. As we see, there is a helmet which is mask, and therefore the face shield, and also is covered with all the gown, plus there is a gloves. So and even there we should also wear good footwear so that we don't get the infection in this. Now what are the activities at the risk for sharp injury? As HIV specialist, I always get lot of inquiries regarding how we have a needle, how we can prevent needle stick injuries, or if we have a needle stick injury, how we can get rid of the infection. So as we know, HIV, HCV, HBV are the infections that occur due to needle stick injuries, and as we know, the commonest occurring thing is hepatitis B, and it is 30% of chances of getting the infection. Secondly, HCV is only 3% and HIV is 0.3%. So as we see, the HIV element is low, but if you see, the fear for the infection is HIV, because it is a taboo or stigma to the people and community, and still people are not getting aware of how we can avoid infection. But if we want to limit the injury of sharp or risk of sharp injury, we should stop recapping, needle recapping. And as you know, if you can just use one hand, definitely it will not injure the person. Secondly, body fluids aliquoting. If we have bifurcation, then definitely we have a little amount of this. Then open the tubes properly and throw the sharps to the sharp container. So the transmission based precautions are: number one, the droplet infection or by sneezing. So used in addition to standard precaution for specified patient with upper respiratory tract infection or airborne infection or epidemiologically higher pathogen like we have corona, we had influenza, we had H1N1. These all infections which are airborne, which are droplet or contact transmission, they can be definitely curbed with with having additional precaution to the standard precaution. So, droplet infection is that in which the infected individual will affect the other person, certified individual from the droplets, and the susceptible individual then will after transmit to other people. So, there are two types of infection that can have. Number one is a short range transmission and number is a long range transmission. So, what is a short range transmission? Suppose a person is near to it in a shorter range, then while a person sneezes or the person coughs, the droplet infection can spread to them. While on the long range transmission, this can remain in the air, and if you travel that common area, then we can have a long range transmission also. Also, how we can prevent it? We can prevent it by number one, using ventilation. If you have good cross ventilation, there is a lesser risk, as the air will carry away the infection or the droplets, and that will not remain there in the same area. So, it will be breathless. Secondly, by using personal protection like mask, hand washing and antiseptic precaution gloves, so that they will decrease the droplet infection and we can avoid the infection in the persons. So, droplet infections with more than 5 microns of the infection agent is more transmissible, and examples are pertussis, meningococcal meningitis, very commonly seen, and in immunocompromised people this infection has spread at a higher rate. Also, we can decrease this by using private rooms, even by using masks within 3 feet of patients. This can be decreased. So, preventing infection by large droplet forms by sneezing, coughing, talking. The examples are Neisseria meningitis. Then we have pertussis, we have influenza. So, cover your face, simple way, cover with your hands, cover with your napkins, and we can decrease the infection to the other person. So, having good cough etiquettes will decrease the infection to a higher level than just having the infection. So, airborne transmissions are very common, and if the droplet nuclei is less than 5 microns of this, then there are examples like tuberculosis, measles, and we know we are the home of tuberculosis in India. It is very endemic, and these infections, they can be definitely decreased by using isolating rooms under negative pressure, using N90 for HEPA respiratory use. This definitely will decrease the infection and definitely increase the health of the people. So, the airborne precautions for the avian influenza, what we need a N95 respirator, patient in isolation, cohorting patient transport, limit patient movement and transport, place surgical mask on the patient, airborne isolation room if available, in which we have air exhaust to outside or recirculate with HEPA filtration. HEPA filters are very common now, and these definitely help to decrease the infection and filter the air. So, there are a lot of filters available. We can use room air HEPA filters, and these definitely decrease the infection. Linens. So, transmitting the linens and handling them in a manner in which they will prevent skin and mucous membrane exposures and contamination of the clothing. They would avoid transfer of pathogen to the other patient on the environment. So, this should be clean and as will be disinfected in a waste disposal. As you know, safe waste disposal is the key to decrease the infection, and if you ensure the safety, definitely we are in a higher agenda to decrease the infection. So, if you want to treat waste contaminated with blood, body fluid, secretion and excretion as clinical waste in accordance with the local regulation, definitely we will have the upper hand in controlling the infection. So, segregation is important, and after segregation we should know how to dispose that. So, human tissues and laboratory waste that is directly associated with specimen processing should also be treated as clinical waste. So, any thing that is used once definitely should be discarded. If you discard that, definitely we will have the less infection. So, and as we know, when we are working with patients, the patients handle equipment. This equipment, when handled, they can be soiled, they can be smeared with blood or body fluids or secretions and excretions, so that there can be contamination. It can be contamination of the clothing, contamination of the patient surfaces and other things also, environment also. So, we need to clean, disinfect and reprocess reusable equipment appropriately before use with other patient. That is one of the key thing we should understand before treating. So we started with using newer needles, new syringe, or use one-sided syringe, even also tongue depressors, even other parts, other instruments that we use for patient, they definitely change. So about the contact precautions. So if a person is found positive and then person who is living in his house, family or society, the how should we decrease it? This is called as contact isolation, and before having contact entering the room, the person should we should clean our hands, we should have our gowns clean, we should have gloves clean, and this will decrease the infection. So for protecting against skin to skin contact and physical transfer of microorganism to the host from a source, we require this kind of help, which also decreases the infection. Also we can have private rooms, and also we can also go for treating various other infections like scabies, skin diseases. Okay, this can be treated with proper use of clean hands, gowns and gloves. So that should conclude our talk for today, and I have briefly concluded all the major points for safety precautions. Safety precaution is must, and if we have to have a future bright generation with smiling kids, our takeaway home is for today is that we should invest in PPE, we should invest in hand hygiene, we should invest in cough etiquette, so that we can have a better generation of people. Thank you very much. I am Dr. Udaykumar from Life Care Clinic, representing the Life Care Clinic for infectious disease, specialized for HIV/AIDS management. If any query is there, you can revert back on my mobile number or on my email address, so that I can help you to get away with the right judgment or right benefits of the safety precautions.